Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you are all fine and doing well for your RRB exam as well as for the nursing competitive exams. We are uploading very important 5 questions weekly twice for the exams of all the nursing competitive exams. So kindly subscribe our channel and follow our channel for the more updates regarding the nursing competitive exams. Okay, we'll start today's session with a small quote. It does not matter how slowly you go, as long as you do not stop. நீங்க எவ்வளவு ஸ்லோவா போறீங்கிறது முக்கியம் இல்லை, போகணும், நிக்காம போகணும், அதுதான் முக்கியம். Okay, we'll see 5 important MCQs today's. Okay, today we are going to see about obstetrics and gynecology related questions. First question, the vaginal pH is acidic due to options due to Doderlin bacillus, cervical mucus changes, both 1 and 2, neither 1 or 2. So why the vaginal pH is acidic? So what is the condition? What is the pathophysiology is going on? Because of, answer is due to the Doderlin bacillus. The vaginal pH, everybody knows it is acidic due to this presence of this Doderlin bacillus. It is otherwise called as lactobacillus. Okay, 2 names are there. In exams, any name can come. Okay, so Doderlin bacillus or lactobacillus. So these bacteria produces the lactic acids, which helps to maintain our the vagina in the acidic condition. Okay, so why this acidic condition is very, very important to maintain the vaginal microbe. By that environment, it should be acidic. Otherwise, there is a growth of bacterial growth can happen. So the acidic pH is very, very important. Okay, and cervical mucus also can produce the vaginal pH into acidic, but that is very, very, very minimal. So always that due to the Doderlin bacillus, the correct answer is the primary cause for the acidic environment of the vagina. Okay. Next question. Which hormone induces the ovum development during menstrual cycle? Options: estrogen, progesterone, FSH, that is follicle stimulating hormone, none of the above. So which hormone is mainly responsible for hormone induces the ovum development during the menstrual cycle? The correct answer is FSH, option C. So FSH is, everybody knows, produced from the pituitary gland. Okay, so pituitary gland stimulates both of the ovarian follicles, which contains the eggs. Okay, so this follicle mature and then release the estrogen. Okay, so what is the role of this progesterone? Progesterone during the pregnancy period, which maintains the uterus line. That is the main function of the progesterone during the pregnancy time. Maintaining the inner lining of the uterus, this progesterone will maintain the pregnancy. So that is the role of progesterone. So the main hormone induces the ovum development during the menstrual cycle is FSH. Okay. So main 3 hormones we should study: FSH, progesterone, and estrogen. Very, very important. Many exams, definitely one questions will be regarding from these hormones. Okay. Next, how are frenulum and clitoris are formed? So we know that external genitalia of female reproductive systems, and that frenulum, clitoris we should know. I will show the image. Okay, so which part can form this frenulum and clitoris? Options: fossa navicularis, mons veneris, labia majora, labia minora. So the correct option is labia minora. So you can see this once again. Sorry. Okay, you can see it here. So this is the external genitalia. In this, we have mons, this outer layer. The outer white layer is called labia majora. This is mons pubis. This is labia majora. This pink color part is labia minora. So most of the parts, external genitalia parts are present inside this labia minora only. The question is how the frenulum and clitoris is formed. You can see this is the frenulum of clitoris. This is the frenulum of frenulum of labia. This green color part is glans clitoris. So these two parts, this including this frenulum, it is formed by the labia minora. This is a labia minora. Okay, this is labia majora. So that is the question. How are the frenulum and clitoris are formed? With the use of labia minora. So next question. Postpartum client exhibited positive Homan sign indicating thrombophlebitis. The sign is elicited by. It's a very easy question. Everybody knows. Options: plantar extension, dorsiflexion, pointing the toes, extending the knees. The correct option is dorsiflexion. Right? We know now Homan sign. How will you test the Homan sign? Make the patient in a supine position, elevate the leg, whichever the leg you are suspecting the thrombophlebitis, elevate the leg and dorsiflexion of the foot. This is dorsiflexion. If you dorsiflex, the patient will have the pain in the calf muscles, not the plantar flexion. Okay, not the plantar flexion. Plantar flexion, it's not plantar extension, also not there. Dorsiflexion is the correct option. Okay, next question. A client in labor has been pushing effectively for 1 hour. The nurse determines that the client's primary physiological need at this time is to what? Options: ambulate, rest between contractions, change position frequently, consume oral food. This is also easy. Physiological need here is rest between contractions. Okay. So during the labor, rest between the contraction is very, very, very important for the mother to push effectively for the easy delivery of the fetus. Okay. So in between the contraction, as a nurse, we have to provide a rest. We have to tell the patient to take a rest adequately. That is very, very, very important. Okay. Rather than ambulate, rather than positioning, changing the position frequently, we should not give oral foods. Okay. Sips of water we can give. Okay. Ice chips can be given because there is chance of aspiration. If they required any surgery immediately, cesarean section, we cannot give the oral foods. Okay. So sips of ice can be given. Sips of water can be given. Okay. So that's all about today's class. I hope this class was helpful for you. Please follow our YouTube channel and please subscribe our channel. Thank you all. We'll meet you in next class.